Mr. David Herndon Rains was born in Dexter, Arkansas in 1860. He became a successful and prosperous farmer in Pine Island, Louisiana. He moved to 1419 Peabody Street in Shreveport. He was noted as a businessman, community builder, and philanthropist, and by 1936 was worth more than $1 million from oil holdings and properties owned. His most outstanding contribution was to help boys who had been labeled juvenile delinquents, and gave 22 acres of land for the sole purpose of providing facilities and space to help troubled boys become better citizens. The land is located in North Shreveport, formerly known as the Cooper Road Community and now known as the Martin Luther King Jr. Community. In an effort to bring health care to the underserved residents of the Cooper Road area, a group of local area leaders formed the Cooper Road Clinic, which opened in March 1971. A group of African American physicians, as well as faculty and medical residents from LSU Medical School, volunteered their services to the Cooper Road Clinic. Aided by a slate of nurses and paramedical personnel, the group provided free medical services for what would later be formally organized in February 1973 as the Cooper Road Medical Clinic. Under the medical leadership of Dr. Alan J. Herbert and Dr. Ralph W. Baucom, services were offered for most of the Cooper Road residents for free as part of the charity hospital system under the then Confederate Memorial Hospital, which is now University Health. In 1992, David Rains Community Health Centers was established as a federally qualified health center under the medical leadership of Dr. Larry Daniels. Since its inception, David Rains Community Health Centers has provided quality and affordable primary care services while expanding access to services at 6 clinic locations in 5 cities throughout northwest Louisiana: Shreveport North, Gillum, Minden, Haynesville, Bossier City, Shreveport West, corporate headquarters.
When I first came initially, we had one site, and the next year we picked up our second site.
We've grown tremendously over the last 20 plus years. Started out as an organization with essentially one location, expanded to Gillum, Louisiana with our second location in 1996.
Well, the expansion to both urban and rural communities in our area has just been outstanding. To think that we started with basically a concept, so to speak, of a small clinic, and now expanding and serving other areas and providing a holistic approach to health care for our fellow citizens.
David Rains Community Health Centers has evolved from a small clinical team to a vibrant company that employs approximately 150 staff members throughout the organization and has a board of directors that provide oversight for the direction and growth of the organization.
I think David Rains is a wonderful place to work. We have some dedicated, loyal people, and that when patients come here, they will receive the services that they need.
As a board member, we just provide a governance structure that allows the executive staff to administer the program and to manage the services that we provide to our clients.
We have great, excellent staff members. Our CEO is just tremendous. He is awesome, progressive, and everything.
You have employees who are persons who that really care about the neighborhood, they care about the people.
David Rains is a great place to receive care because it has a number of very caring professionals that are fully committed to deliver great medical care to our community. We are very committed to take care of our population and our patients.
Without services provided by David Rains Community Health Centers, there would be a lack of access to affordable quality health care. Many individuals within our region would have to leave their local communities, driving as much as an hour to receive primary care services. Providing access to affordable quality health care is the organization's core mission, whether it is in rural Louisiana or in an urban setting.
Well, here we offer a vast array of medical and dental services as well. We also have behavioral health services and dental services at all of our clinics.
Unfortunately, there are so many people in our communities and across the country that cannot access quality health care just because of their financial condition. And federally qualified health centers such as David Raines Community Health Centers are designed to help break down those barriers. And so we're here to break down barriers. We have access to care as a Medicaid provider. We also provide discounted services for those who qualify based on their income.
I enjoy working here fantastically. You know, I had over 40 years in private practice, and this is like night and day from the private practice. It is extremely rewarding because I'm helping people that I was never able to help.
I once worked in this area at Newton Smith. I was a teacher, retired teacher, and also a school board member. And I knew this community. It's a wonderful community. All kinds of people are here. Many of our people here do not have any kind of medical care, and they cannot afford it. But here with David Raines, they have provided those services to the people who actually need it the most.
Well, rural areas are in particular need of access to services. Usually there are fewer providers. There are fewer providers that will accept, say, Medicaid, that may not have any mechanism that allows persons who may not have insurance coverage to be able to access care.
It's a huge impact for the community because we're able to bring affordable health care to the community in which they actually live, where they don't have to go out to other places far, far away. They can have a long-term relationship with their physician and get all the care that they need in the place that they live.
As part of our mission, which is to serve particularly underserved areas, to move in those areas where the opportunities have presented themselves. And we've done that in Claiborne Parish and Webster Parish, in addition to Bossier and Caddo Parish.
Well, I think we offer some services that you say private industry can't offer or just not willing to, in a sense, for whatever reason, and we're able to do that, and that make us competitive.
As a board member, I actually already receive care here, so I'm a patient here at David Raines. So in all of the time that I've been a patient here, I've received nothing but wonderful care and great service.
I'm a principal of a school, and I've had the opportunity to actually recommend to parents, recommend students to get care. And I've actually got care through David Raines as well.
Visiting our clinic sites is comparable to receiving services at any other physician's office in the community. In 2002, David Raines received Joint Commission accreditation for meeting the national standard for providing quality care. The organization also received the nationally recognized designation as a patient-centered medical home.
We are Joint Commission accredited. We are also a patient-centered medical home. And as such, we have to meet certain standards of care. We try to provide more of a organized approach to care. We try to be more proactive with the patient's care. We work as a team. My nurse, myself, the front desk person. The visits are more structured. We see patients on a regular basis, and we try to provide all the care that they need.
What I'd like people to know is it's a great organization. We have a great staff. Nothing happens without people. And we have some of the best people you can find anywhere. We have some of the best practitioners that you can find anywhere, board certified, well-trained support staff that helps to work with those persons to deliver care. I don't think you can find any better anywhere in Shreveport, Bossier, or anywhere in the state or in the country. We just have a great group of people who are committed to the mission of the organization.
During the last 25 years, David Raines Community Health Centers expanded locations and their services. The organization now offers family medicine, pediatrics, general dentistry, behavioral health, optometry, WIC, DCSF assistance, Medicaid and Affordable Care Act enrollment, free transportation, and 2 full-service pharmacies.
We started out with just medical services. We added dental, behavioral health, transportation. We've also added 2 pharmacies. pediatric services, WIC services, and we've just continued to grow both in terms of our delivery sites, but also in terms of the number of different services that we also provide.
We have really grown. We are a major part now of the healthcare safety network for the nation. Here at David Raines, vast array of services. I like to say that it's one-stop shopping.
The future is bright for David Raines Community Health Centers.
The one thing you could say about David Raines is that they provide passionate health care, and the people who are in charge recognize that that's a cornerstone of delivery of quality services for our patients.
And as long as there are needs in the community, there are opportunities for us to grow and try to provide those needs. So I see growth in our future, continued expansion of delivery sites and or services that we offer. And we're looking very closely at how we can do that and address some of the needs in the communities.